Hi everybody, my name is Dr. Saf and welcome to my YouTube channel Safe Critical Care. Today I am going to discuss on very important drug which is used in ICU, COVID-19 ICU and the patients who are admitted in COVID ICU, the Tocilizumab. The drug has gained wide popularity but it is not being manufactured in that amount and sometimes it is being sold in the black market. So this is the reason I thought that I should make a presentation on this, and then I gathered all the papers, articles, and then read a lot, and then after days of hard work I could prepare this presentation, the role of Tocilizumab in severe COVID-19 patient. So I hope you will enjoy it, and let's begin. Thank you. Tocilizumab, a recombinant monoclonal antibody, has been proposed as a potential therapy for the cytokine storm syndrome associated with severe COVID-19 pneumonia and ARDS. Tocilizumab is available in the form of sterile solution. One vial of 20 ml contains 400 mg of drug. The dose is 8 mg per kg infusion over 1 hour up to a maximum dose of 800 mg IV. Many people are questioning its effectiveness due to its very high cost. This drug is advised when patient is going into cytokine storm, which is manifested by fever, tachycardia and severe desaturation. Interleukin 6 is the main pro-inflammatory cytokine released in the severe COVID illness. Tocilizumab helps to block IL-6 receptor, that is interleukin 6 receptor, reducing the intensity of host response. Despite sound pathophysiological basis, the Tocilizumab fails to reduce the mortality in many patients. Despite this, many centers around the world are using this drug in COVID ICU. So, let's discuss few studies which have been conducted in last few months regarding efficacy of Tocilizumab in severe COVID-19 pneumonia and ARDS. This is the first study published in May 2019. It was a small retrospective study from China, showed the positive results. Fever, that is the body temperature, returned to normal on the first day of the Tocilizumab injection, and other symptoms also improved remarkably within a few days. C-reactive protein and oxygen support, NIV or invasive ventilation also decreased, and oxygen saturation picked up on day 5 to the maximum. CT scan of the chest also manifested that the lung lesion opacities absorbed in 19 patients, that is about 90% of the cases. In this retrospective cohort study, treatment of severe COVID-19 patients with a single intravenous infusion of low-dose Tocilizumab, that is 8 mg per kg up to 400 mg, resulted in favorable outcomes such as shorter time to clinical improvement, shorter duration of invasive ventilation, and shorter duration of vasopressor support compared to a control group. This is the first large multicentric retrospective study from Italy enrolling 544 severe COVID-19 pneumonia patients, among which 179 patients received Tocilizumab in the form of intravenous or subcutaneous injections. After adjustment for sex, age, recruiting center, duration of symptoms and SOFA score, Tocilizumab treatment was associated with a reduced risk of invasive mechanical ventilation or death. The adjusted hazard ratio was 0.61. 764 patients with COVID-19 received Tocilizumab in this study, which was retrospective in nature and also was recently published in Lancet. This study was conducted in 13 US hospitals, enrolling 764 patients in ICU, among which 210, that is 27% patients received Tocilizumab. They found patients with COVID-19 requiring ICU support receiving Tocilizumab had reduced mortality, 49% versus 61%. Now we have results coming from first phase 3 RCT called COVACTA study. Roche has announced that it did not meet its primary endpoint. The results from this COVACTA trial released in July 2020 were quite disappointing. The difference in clinical status at week 4 between patients treated with tocilizumab and those given placebo was not statistically significant. There was no difference in the mortality. There was no difference in the ventilator-free days also. So what should I do? In desperate situation, if patients can afford the treatment cost of tocilizumab, we may infuse this drug and save the life, but only in very few patients. However, there is no point in including this drug into standard treatment protocol for